Now, the reason I stress so much as to why the coronary arteries left and right are the first branches of the aorta, period, is because the aorta has three different portions: the ascending aorta, the aortic arch, and the descending aorta. And it kind of depends which portion of the aorta we are talking about whenever we want to talk about the first branch, such as the aorta. In general, the first branches are the coronary arteries, but the aortic arch specifically, its first branch is the brachiocephalic trunk. Now, aside from the three layers of the heart and their associated structures, we can talk about the three grooves. Starting, we have the atrioventricular groove, also known as the coronary sulcus. It's also known as the coronary sulcus because the coronary venous sinus is found here. And this coronary venous sinus is unique because all cardiac veins drain here except the anterior cardiac veins. So all cardiac veins have one main drainage point before that relays the blood into the right atrium, and that drainage point is the coronary venous sinus, and it's found on the posterior aspect of the heart in between the atria and ventricles, hence atrioventricular groove. And therefore, it makes sense as to why the anterior cardiac veins would not drain here, because if they are eventually going to make their way into the right atrium, why would they take a longer route to get there? Now, the coronary venous sinus is not the only structure found within this atrioventricular sulcus, as we have the circumflex artery here as well. And this circumflex artery is a branch off the left coronary artery, along with the left anterior descending artery. Now, this left anterior descending artery is not found within this coronary sulcus, but the circumflex artery is found within this coronary sulcus and is a branch off the left coronary artery, with the other branch being the left anterior descending artery. And that left anterior descending artery is nicknamed the widowmaker because it's the primary artery obstructed with coronary artery disease, which is a subtype of atherosclerosis, and it usually leads to a myocardial infarction and eventually death, hence widowmaker. Now, aside from the atrioventricular groove, also known as the coronary sulcus, we have two other grooves. Those are both interventricular grooves. One's on the anterior aspect of the heart and one's on the posterior. Now, looking at the anterior interventricular groove, it has two structures: the left anterior descending artery, which we know is one of the two main branches off the left coronary artery, and we also have the great cardiac vein in this anterior interventricular groove or sulcus. The way we remember the two structures that sit here is by LG. LG typically stands for large, but we're going to use this mnemonic to help us remember that the left anterior descending artery and great cardiac vein are found in this anterior interventricular groove.